So, Ramiko, as we talked about, you have a lot of tension in your low back and discomfort in there. So what we're going to do is I'm going to show you how to stretch out that low back with this handy dandy unit that we have here. And you're going to notice if you do this every single day, it's really going to decrease the amount of tension that's residing down in the low back, and it's going to give you a little more flexibility. So what I recommend first is you're going to stand up for me. What I'd like you to do is face the window. You're going to reach down towards your toes, and I just want you to get a before and an after as far as how it feels right now versus what it's going to feel like. So go ahead and reach down towards your toes. Okay, and just notice the tension, tightness that you have in here. And then you're going to stand up. And what I want you to do is I'm going to have you lay down flat on your back, and you're going to put this right in the low of your back, right where that curve is, okay? We're going to put your head on this angle, on this end, and then go ahead and lay flat on your back. And then once you lay down, I'm going to go ahead and tuck this. You can bend your knees and put your feet on the little paper right there. Perfect. And then if you'll lift your bum up, I'm going to slide that in, and then go ahead and position it to your comfort level where that area is on your low back. Does that feel about right?
Yes.
Fantastic. So what I'm going to have you do is, these are 2 pump up valves, okay? Notice how when I pump them up, you're going to feel the air in your low back. And then this is a release valve. So when I say release, you're just going to push on this valve, and that is what's going to have the air go out of that low back. Okay, so we're going to put these in your hand. And then what I want you to do is I want you to pump them up to your comfort level. So go ahead and pump it up. It could be 2, it could be 10, just depending on the tension you have back there. So once you pump those up, tell me when you get to that point.
Okay.
And then what I'm going to have you do is I'm going to have you pelvic rock down 5 times. And I'm going to show you what that feels like. I'm going to put my hands right here. You okay with that? Perfect. Now you're going to tilt down, and then you're going to come back to center. Down, and you're going to do that 5 times. So you're going to pelvic rock down 5 times, and then you're going to pelvic rock up 5 times. So you're just rocking up and then back to center. It's ever so subtle with that movement. After you're done doing 5 down and 5 up, now you're going to go ahead and release that air, and then pump it back up, and we're going to repeat that again. Good. So you're going to rock down for 5, and you're going to rock up for 5. And I just want to be very clear that when you do this, you don't want your body raising off that. You're going to stay on it. It's just ever so subtle movement. And what I'd like to explain to you, Miko, is when you are rocking over that pocket of air, what's happening is we're literally opening up that space between the vertebra, and it allows for nice, new, good, fresh blood supply to filtrate into the muscles, the ligaments, and the disc. And it really feeds it. It hydrates that disc so it's a little bit more happy in that area. And then you're going to let it out, and we're going to repeat that again. And we're going to do 6 rounds of this. So go ahead and pump it up again. And then you're going to pelvic rock down and pelvic rock up, 5 in each direction. So I'm having you do 6 rounds of this. The ultimate goal is to reach 10 rounds. So again, the goal is to pump it up, 5 pelvic rock down, 5 pelvic rock up, and then to repeat that. Ultimately, the goal is to get to 10. We're not going to do that overnight. Go ahead and let it out. Let's repeat that again. We're not going to get there overnight, but let's just say today you feel really good at 6. Tomorrow we can increase it to 7. The next day maybe to 8. And then from there, our goal is just really to increase that motion. Okay, so let's pretend we're now on our 6th round. We're going to have you actually go ahead and pump that back up. Let's do one more round. This is actually number 6. So you're going to pelvic rock down 5, and then I'm going to hold them and pelvic rock up 5. And then what we're going to do next is we're going to lie on this for 3 minutes while the air is in there. We're not going to take the air out, and I'm going to time it here. And we're going to go for 3 minutes. Now, as we do this, you may start to feel a little bit of a stretch, and perhaps maybe just a little bit of pain or a little bit of tug or discomfort. That's okay. I recommend not just giving up and pushing the buttons and getting all the air out. I recommend just giving a little bit of the air out, not all the way though. Okay, so the goal is to be able to lay on it for 3 minutes. We're going to see how you do with this, but let's just say that all of a sudden you get to 2 minutes and you're like, oh, it's really hurting. That's when you're just going to let some of that air out. If it gets to a point where you're like, no, it's unbearable, then just be done. 2 minutes is your max. And our goal is to build from 2 minutes, again, to get all the way to laying on it for 10 minutes. So each day, you can increase it by a minute. If you get to a point and all of a sudden you're at 5 minutes, you're like, ooh, that's a lot. You can stay at 5 minutes for a couple days until you feel like, ooh, that feels pretty good, I can handle it. don't feel like you have to be like a weekend warrior and get it to 10 rounds and lay on it for 10 minutes. The goal is to really slowly integrate and put more mobility in that area where it tends to be tight. Does that make sense?
Makes sense.
Out of everything that I've given you, the TENS unit is going to help for pain. The lumbar brace is going to help for posture, meaning to take some of that pressure off the low back, or even just to increase the posture in the neck so you sit up properly. So with this, it's my most favorite because if you're really good about it, meaning if you really can do it 7 days a week, you're going to notice a huge difference in the mobility in that low back. You're not going to have as much tension lingering. We do recommend at least 3 days for sure. And if you can do more than that, then that's like icing on the cake. It's really about what kind of results do you want. If you stretch it out and you're compliant with it, you're going to have great results and less tension in that area. So we are 2 minutes in. Are you okay? Any pain? No pain. Okay, so the patient doesn't have pain, so we're gonna hang with 1 more minute. And then from there, if you're good, you get a piece of candy. No, I'm just kidding. If you're good, then I would love for you to take it to 4 minutes, okay? And so after we're done with this next minute, we're just gonna stretch out your legs, and I'm gonna instruct you how to do so. You're gonna stretch out those legs, and it's gonna take some of the pressure off the low back. Let's keep these knees bent just for the remainder of the portion of it, and then you can relax here just shortly. And so then we're gonna go ahead. We're now at 3 minutes, and what we're gonna do is let the air out of the receptacles. We're gonna drop those down. I'm gonna have you take your left knee and you're gonna bring it up to your chest, and you're gonna hold it with your hands for 15 seconds. Both sides. So we're gonna do the left side. Then we'll go to the right side, and then we're gonna bring them both up together. Then after that, we're gonna have you stand up and just reach down for those toes, and you're gonna tell us if you notice there's a little bit more mobility. Go ahead and switch. Let's keep that one bent. Good. Any pain upon the stretching?
No.
Fantastic. Good. 3, 2, and 1. Now roll them up. Any pain or discomfort with that?
No.
Awesome. Okay, I'm gonna bring you on up. I'm gonna have you step to the side. You're gonna face the window. And what I'd like for you to do is just reach down towards the ground, and you tell me if you notice just a little bit more flexibility.
Yes, definitely.
Right, so that's what I'm talking about. We're gonna hydrate that area of the low back, not with water, but by putting new blood flow in that region. And like I said, if you stick to it, you're going to notice a huge difference. So out of everything, this is one that I highly recommend for you to try and do daily if you can.
Perfect.
Awesome.
Thanks, Dr. Hudson.
You are very welcome, my dear. And you can take that with you and have a wonderful day. Bye. See, it's just that easy.